Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. You sound so like radio voice when you do the intro. You sound very like smooth.
Well, I do have experience in voice work.
The ASMR Nicole.
Yeah. I try.
You try.
I try and I succeed.
You do. You have one of those easy voices. I do not like my voice, although the podcast has helped me to accept my voice.
We're all about voice acceptance over here at Medical Media Mixer.
But you know what I mean? Like when you hear your own voice and you're like, ooh, what is that? You know, It sounds so strange. It has helped me to be like, whatever. That's me.
Yeah. I will never forget. It was one time when I was a teenager and I was home alone and I answered the phone and the person thought I was a man and I was so mad. I was like, I know I don't have like a super like girly voice, but I was like, really?
Really?
Yeah, I was so pissed off.
I had something I was going to say before that and I lost it.
Sorry.
It went away. It went out of my
Maybe it'll
head.
come back. Maybe it'll go woo, woo, woo and come back.
Those are the sound effects. Yeah. Oh, I did. This is one thing I noticed that I definitely talk fast. Sorry, people. And sometimes
like I don't.
Like I sometimes like my brain is moving faster than my mouth. And so the words are sometimes like abbreviated at times. When I listen back to edit, I hear that. You know me, so you understand me.
No, my face is that is a symptom of ADHD. No, I know that I talk too fast. Just at baseline, I know that. But I told you, and you say I'm completely unhinged because I listen to everything at 1.5 speed.
Yeah, only audiobooks for me, not podcasts.
So when I listen to myself back, I'm like, wait, what, girl? Because I already talk fast. So then it's like 3 times speed.
That's the thing in New Jersey. We get told that we talk fast.
Because we have to, because we have a lot of things to do, a lot of places to be.
I know. The only other thing too is I still mask at work, even though I don't have to. It's because I have to like really get.
I thought you meant like
close.
Theoretically masking. I'm like, what are you masking, girl?
No, I get up and close and like talk to people. So I keep it on while I'm talking to people. And some of my patients who are elderly and can't hear well and maybe are refusing to wear hearing aids have trouble with that. I have one woman who I do take a mask off for all the time, and she understands if she's sick, like I'll put it on when I examine her because she actually has a cochlear implant. She's hearing impaired for her whole life. Like she's
used to it though. Yeah.
Some of these older people, like they can hear, but I just have to slow down and go louder and enunciate better. Do you ever get where people mishear your name? Like I get that with older people.
What do they mishear your name as?
Carol.
Carol?
Yes. Tara, Carol.
No.
Yeah. Old people constantly like it's, I mean, I'm talking like nursing home population, but older patients. Yeah. Hi, my name is Tara. Oh, hi, Carol.
And it's so funny you said that because I was going to say, how are you introducing yourself?
Yeah. My name is Tara Prisco. I'm a PA, work with your doctor's group, but yeah.
So that's the thing. And it took me a very, very, very long time to get used to this. But I even hate to say it right now. I like cringe at myself. I do introduce myself as Dr. Peniston.
You earned it. Hey, you got the degree. Use it.
It's still, I mean, yes. And in that role, yes, I am your doctor. So I'm fine with that. But then like, and I do like it that like at the practice, everybody calls you by like your title. So like everybody calls me doctor, but then I get like weirded out when we're like just sitting and talking about like what we watched on TV.
Right.
And I'm like, I'm not your doctor. Like it's okay.
Right.
And like every once in a while they'll call me Nicole, which I have no problem with, but like I feel like they're so used to using the title that it's hard. And
Yeah.
it's somebody who I'm like more friends with now. We don't see each other that often, but I used to work with her, and she always called me Dr. Peniston, like even when I wasn't used to it yet. And I would
Yeah.
always be like, no,
Don't. So,
but I'm
like
used to it now.
my boss, who I've worked with for almost 20 years, we call him Dr. T. I mean, his
Hmm.
name's longer than that, but it's just easier. Like,
Yeah.
even though I could call him by his first name, like I refer to him, whatever. And same thing, there's an eye doctor in our office and we call her Dr. V. Like,
Hmm.
it's just easier, even though we could call them by their first name. They have no problem with that
Right.
whatsoever. For
Well,
me,
and with like kids, I will say like I'm Dr. Nicole.
yeah,
Um,
that's more accessible for children. So
yeah.
if you ever, I'm sure you've seen things online, videos about that though. Men can get away with introducing themselves by their first name. Women can't, because then they're automatically the nurse or the whatever or the aide. And those are
Hmm.
absolutely respectable positions. But they will never understand your
It
title because
diminishes your title.
they will assume. So I always say Tara Prisco, physician assistant, like the
Right.
first time I meet you.
Right.
And some of the forgetful patients, I'll do it every single time. My
Hmm.
patients in the office who know me, Tara. Some of them like to call me Dr. Tara. They know I'm not a doctor. I clearly say physician
Right.
assistant, like all my titles, wear labels on me, the whole thing. They just feel more comfortable, more formal saying that. But it's
And I do
interesting.
say, I think in most situations, people are not trying to be offensive when they're not
Mm-mm.
using your
Mm-mm.
title. I don't think it's as deep as that.
No.
But I have had a very distinct situation that sticks out in my head about it was many, many moons ago, and I was evaluating a very young child. And so the mom and dad were there, and the dad was pissed off about something that had nothing to do with me. And he kept calling me that girl or
Oh.
sweetie or honey. And I am
Mm-mm.
not one to pull rank. People know this, but I looked him dead in the face and said, my title is Dr. Peniston. Please use that title.
Yeah.
I've never done that again in my life. And I
But
was probably
just
shaking the whole day. But the fact that he was like mad and then like, well, this lady doesn't know what the hell she's doing. Like, sweetie, figure it out. I'm just like,
uh-uh.
excuse me. Like, you want me to care for your child? Like,
Right.
I have the background to do so. So please treat me as such. Like, it's
People are
not.
crazy.
But like, then I'll have other people who will call me like especially older folks who call me like honey or like
Right.
love
But
or
they're
like
using
whatever.
it in an endearing way. It's different.
Exactly. And they're still like, they're being positive about it. But
Exactly.
unfortunately, I think what happens more often in women in our profession is those, when they're not using our titles, it tends to be in more of a condescending way when it happens.
Yeah. Yeah.
Yeah.
Well, we work for them, use them. Dr. Peniston,
I
at your
try. It's
service.
hard. Like at times like this where I'm like at home, like wearing a sweatshirt and like
Yeah.
leggings, I'm like, I'm not Dr. Peniston. Or like I've gone to the store and like been like casual, like in jeans and like a t-shirt. And in my head, I'm like, is this how a doctor dresses? And I'm like, I'm not doctoring right now. I'm not doing it right now.
You can be both. That's life. You can be a little bit of everything.
And maybe other people don't overthink it as much as I do, but I do get in my head a lot about it.
You
But
ever run into patients outside the office?
once in a blue moon, I think I told this story. I've told the story a lot because it was just hilarious. There was one time, it was like a Sunday afternoon, and I was at Whole Foods, and I was like in sweatpants and like probably a dirty t-shirt. My hair was in a bun. And in my cart at Wegmans was like a giant thing of toilet paper, 3 bottles of wine, and a piece of cake. And a little kid that I was treating ran up to me and gave me a hug and was like, Dr. Nicole. And like, I was very familiar with this patient.
Yeah.
And the mom comes over and she looks in my cart and she's like, been there. And I'm like, I'm just doing my shopping. Don't judge me.
No, I'm having a mental health day just like everybody else.
And like, she was like joking. Like, she was very lovely. I was not offended. I just felt self-conscious. I was like, oh my gosh, they're seeing me in like non-professional mode.
What's even funnier is because I wear my mask in the room, like I'll take it off. Like
people may not recognize you
in the waiting room. I'm like, Tara from the doctor's office. Because it takes people a second.
Well, that's the difference though. If by the code that I work under, if I see patients in public, I'm not allowed to say anything unless they approach me.
Oh, really? I don't have any
I've run into
code.
Patients many, many times, but they haven't noticed me or approached me. But due to the confidentiality and the nature of my work, we are not supposed to approach patients unless they come to us first.
since I live very close to where I work, I definitely run into people, here and there.
Yeah.
It's not like a lot. It's a handful, but it's always very cute and
Yeah. I've
nice.
actually had to explain that to patients because it was forever ago when I was working with a couple of teenagers, and a teenager saw me in a store once but didn't come up to me. And then when we had our next session, she's like, I saw you in the store and I know you saw me and you didn't say anything. And so I had to
Aw,
explain to her. I was like, well, I don't know
yeah,
who you're with and if they know that you see a
right.
therapist,
Of
and I didn't want to make it
course.
awkward.
Right,
And she
right,
was
right.
fine. But if anybody out there, you see your therapist in public and they are ignoring you, we're just trying to be respectful.
Right. I understand that.
Yeah.
All right. So I see you've moved on to your Panera refresher or whatever it is.
Well, I was going to get another drink, but I was hoping to do a little bit more work after this, so I need to sober up.
Oh, okay.
I mean, my other drink wasn't super heavy. It was just I didn't want a second drink because I'd like to do some stuff after this.
All right. Let me get
Because we're recording a little earlier than we usually do.
We are, because
so.
it's a Thursday, not a Monday.
And I also work from home again tomorrow. So sometimes when I do that, I tend to stay up later and do more work. So there's less to do the next day.
Okay.
Yeah.
Well, let me tell you what I'm drinking.
What are you drinking?
The Pride and Passion cocktail.
That sounds sexy.
So it's from the Top of the Mark bar at the Intercontinental Mark Hopkins in San Francisco.
It sounds like a convention center.
Yeah, I
The
don't
Mark
know.
Hopkins Convention Center.
But it's made for Pride. So it's obviously, and it's San Francisco. So.
Oh, we didn't say that.
So it's 2 ounces of bourbon, 1 ounce of passion fruit puree or juice. Of course, I needed 1 ounce and I had to get a whole bottle, but that's fine. Now I threw in a little extra. I had this passion fruit liqueur and I threw
Zhuzhed it
in
up.
1 ounce of that just to give it a little extra something. 1/2 ounce of falernum, which is this
I know what
syrup
that
that we
is.
use for our I think it was our first cocktail.
It was a while ago, yes.
It was literally in the beginning. 3 to 4 fresh basil leaves came right off a plant outside, and 3 to 4 ounces of ginger beer. So what you do is you take the basil and you muddle it in the bottom of your shaker with the bourbon and the passion fruit puree and the falernum. Then you throw some ice in, shake it up a bit, and then you strain it into a glass over fresh ice, and you can then top it with the ginger beer and a little stir to combine. And it's actually really nice. I will drink this. I think it's cool. I like it. You could probably substitute almost any liquor in there. Bourbon gives it a certain something.
Mm-hmm.
But if you're not a, brown liquor girl or guy, you can do whatever. I like it. It's enjoyable for sure.
So I have a love-hate relationship with passion fruit, but I also realize as I say that out loud that I think it's actually guava that I don't love the flavor of.
Guava's a little too sweet sometimes.
Yeah. Well, one of them has a more melon-esque flavor, and I don't like melon in general. I don't like honeydew. I don't like... So whichever one is more melony is the one that I'm like, meh.
I think passion fruit's more melony.
But I was also going to bring up, because I've been meaning to tell you, forgot to tell you, forever ago, when you needed Café de Ola, I found Café de Ola flavored coffee, and it was delicious.
Oh,
yes.
that was the Jessie. That was the caffeine episode.
I'm so excited.
Yes, episode 20, I believe, right? That was licking frogs and caffeine.
Wow. I can't believe we're professional adults.
That talk about licking frogs and caffeine.
Yeah. Although, funny enough, I had someone just today, when I was doing her feedback, I was warning her about caffeine intoxication because she was having some symptoms.
Oh, yeah.
And she was like, really? That's a thing? I thought I was just jittery. I was like, no, that means you're having too much.
Yeah. Microdose it slowly throughout the day. Do not overdose it.
I told her she needed to work on reducing in general because she was using way too much.
Yes. Also, it dehydrates you. I don't think people realize alcohol and caffeine both dehydrate you. So they turn off something that signals in your body to retain water. And so you urinate a lot. That's when you drink, you urinate a lot, or you drink coffee.
You break the seal.
Exactly. But then you're losing fluids that technically your body should be holding on to. And so if people are like, I drink a lot of caffeinated beverages all day, but no, just straight up uncaffeinated, I'm like, you're chronically dehydrated.
I'm feeling personally attacked right now. I'm doing better. I'm doing better with my water intake.
Yeah. What happened to your big jug?
I just don't have it here with me right now, but I have been I haven't been on the 80 ounces of water kick anymore. That was a lot to manage, but I'm increasing my water intake daily. So.
Okay. All right.
And we had briefly talked about if they want to sponsor us, Buoy, the like extra hydration
Oh,
drops.
yes.
I
Yes,
did
yes.
end up ordering them and getting them, and they're not bad. They don't really have a flavor, and the flavor that it is there, like if you do like sense it, it's just like a
Subtle.
slight salty flavor.
Okay.
So.
Not bad. Yeah, I do add like electrolytes to water often if I feel like I need like a good
Yeah. I tried a liquid
rehydrate.
IV, but I didn't like the flavor I had.
You know what's actually really good? I don't know if it's out yet. Last summer they had you know the rocket ice pops with the
Yes,
red,
they had a
white, and
liquid
blue?
IV with that. They have it
Yes.
out. I saw
And
it.
I enjoyed that one a lot last year.
Okay. I'll have to try that one then, because I think I got like a pink lemonade one, and I did not like it.
Yeah.
It tasted very salty.
Yeah. There's another one that's out there that is like really salty. We gotten samples of it from something. I don't remember.
Mhm.
But anyway.
Yeah.
So, pride and passion.
Wait, so this is coming out in Pride Month, right?
June. Is it coming in June?
I think it is.
I think it is.
It is. Look at that.
I didn't
We
even
did
do that
it.
intentionally because we record so far ahead. Yes.
No, we did it on
we
purpose.
matched it up.
Yay! Happy Pride Month, everyone.
Yes. So, I'm covering the movie Dallas Buyers Club. Have you seen it?
No.
Okay.
I had to hesitate because I'm like, I know who's in it and I know what it's
you know
about.
everything
but
about
no,
it.
I actually haven't watched it.
It's a serious movie, but there are some fun parts of it.
It's Matthew McConaughey.
Yes.
Can't be that serious. It's Matthew.
I mean, it's pretty serious.
All right.
Do you know who else is in it though? Jared Leto. Or
I was just
Leto.
going to say,
Leto or Leto?
Leto. That's what I always said. But yes, no, I knew he was in it.
Rayon, who is a trans
person
woman back in the 80s. So and fully envelops himself in that character.
I remember when he was filming that because there were pictures and I was like, oh, all right. I mean, Jared Leto is a gorgeous man, so of course he's going to be a gorgeous woman.
Yeah, we were talking about this at dinner the other night with some family. My So-Called Life. Core memory right there. Like,
you know what? I never actually watched that.
It was only one season. It literally.
I mean, I knew the hype. I knew the premise, but I never I might have watched like 1 or 2 episodes, but I wasn't like super into it.
It was a little ahead of its time, and he was amazing.
Yeah.
So, Dallas Buyers Club was out in 2013. So, it's a biographical drama, actually, written by Craig Borton and Melissa Wallach and directed by Jean-Marc Vallée. But it basically tells the real-life story of Ron Woodroof as the character, Matthew McConaughey, a cowboy diagnosed with AIDS in the mid-1980s. There's a doctor.
So, is he actually a cowboy by profession, or he's just a dude
so he's
who
an
likes to dress
electrician and a cowboy.
Okay.
So he's an electrician is his day job, cowboy is his night and weekend job.
So it's not just a fashion choice.
Right.
Okay.
And Jennifer Garner's in this movie. She plays
I did know that.
Dr. Evie Sachs. And then we said Jared Leto as Rayon. So it's based on the real life of Ron Woodroof, a patient of HIV and AIDS who is the subject of a lengthy article in 1992 in the Dallas Morning News. And this article is written by this journalist, Bill Mintaglio. A month before Woodroof died in September of that year, the screenwriter Craig Borton was told about the story by a friend, so he went and he interviewed him before he died to create the screenplay. So it's very important that it really portrays what somebody in those early times went through with HIV.
Well, and I also think it's so crazy because we grew up in HIV is a thing and where did it come from? And now I feel like people don't talk about it because it is so much more treatable now. Oh, yeah. I mean, that's a huge part of what we'll get into. But not only that, I feel like the idea of PrEP is so commonplace that it's people talk about it like vitamins when it's
nothing.
This was massive to our generation.
Yeah. I mean, so what's funny is I wrote a paper on it when I was in 7th grade about trying to find a vaccine for HIV. And spoiler alert, they have not yet. I'm sure you remember in high school where we had to watch the movie Patient Zero. I don't think that was the name of the movie. Something but you know what I'm talking about. Yes. Where they made us watch the movie in, oddly enough, I think it was religion class. It probably was. But I mean, but we talked about the AIDS pandemic and HIV and all that. So yeah. So, back then it was, we didn't know a lot, right? And there was definitely stigmas, and that's very outlined in the movie, as we'll talk about. But like, it was like, don't touch blood of anybody. Don't touch saliva of anybody. Can you get it from the dentist? Can you get it from a toilet seat? Can you this fear, you're going to die if you get it. Like,
but then I think we also learned more like about Ryan White and how he
Yes.
got it through blood transfusions.
Right.
And so I feel like we were also part of that changing
generation, too.
mindset as well of like
Absolutely.
where you can get it from. It's not just gay people. It's not just about sex. It's,
Right.
we learned, I feel
Absolutely.
like honestly, I think it really was good for us to see that progression of just stigma to this can be anyone to, hey, we know how to treat it now.
Absolutely. So we'll go into like the evolution of it. We'll start in the beginning, though. I mean, this is really like the core of where it began. So this screenwriter,
with the guy who had sex with a monkey.
No,
remember when that was a
not
theory?
where it began. But he recorded like hours of interviews with Woodroof. So and he gave him his personal journals to use to help build this script. And then he wrote this script, and he tried to attract interest in like mid 1996. Dennis Hopper was possibly going to direct. Columbia Pictures was involved, but they were
Dennis Hopper, the actor?
Yeah.
Oh, okay. Cool.
But it ended up falling through. They were unable to like secure the financial backing. So it did receive. So this is interesting. 6 nominations at the 86th Academy Awards for Best Picture, Best Actor, Best Supporting Actor, Best Original Screenplay, Best Film Editing, and Best Makeup and Hairstyling.
Now, for context, was this before or after Philadelphia?
I believe before.
And for listeners who don't know, that was also a movie about AIDS, and it did come out around the same time, and it was a different story, but same themes about stigma and things like that.
And so they ended up winning. Matthew McConaughey won, and Jared Leto won, and that's the first time that both the actor and supporting actor both won for the same movie since Mystic River, which is 10 years prior. So this movie was like critically acclaimed, if you could, like,
was
as
it the first awards for both of them?
I don't know, but I would assume so. I don't think there was anything prior to that. I mean, that's a big deal, and this is, quite a while ago.
I mean, I love Matthew McConaughey, but he's usually not in award-winning things.
Yeah, but this, if you see how much weight he lost to play this character.
I remember.
He was owning it. And they did win Best Makeup and Hairstyling, and they had a budget, get this, for makeup and hairstyling.
$50.
$250.
What? I wasn't that far off.
He's really
crazy.
So 1985, Dallas, Texas. That's where we're starting. Ron Woodroof he's a hard-living, hard-drinking electrician, rodeo enthusiast. And they show him the opening scene is him having sex with 2 different women in like the stall of like the rodeo before he goes out. So he was just living it up, doing everything he could and doing everyone he could in sight. And essentially you see him like coughing up blood, getting in with the car with his brother, who's actually a cop. And you see him kind of like he's getting thinner. And you see kind of the difference in lifestyle. His brother's kind of straight-laced cop, and then he's living this wild life. And eventually he goes to the doctor and he gets this diagnosis that he has HIV. And they give him 30 days to live. That's it. 30 days to live.
And that was when it hadn't even advanced to AIDS yet.
So it would be AIDS at that time because he was already coughing up blood, which means he had secondary infections. And they said, I don't remember the exact number, what they said his CD4 count, which we'll get into in detail, was extremely low, which that and a opportunistic infection or an opportunistic cancer are what define AIDS versus HIV.
Off topic, but I was looking it up. Yes, it's the only award Matthew McConaughey won. And fun fact, his mom's from Trenton, New Jersey. Sorry, that was
local
such a
connection.
Tangent. Yeah.
But Ron's reaction is denial, rage. It couldn't happen to him. He wasn't gay. He wasn't a drug user. Well, he was a drug user. He used a lot of cocaine, but not an injection drug user. But his health continues to crumble. Reality kind of sets in. And so he adapts. So essentially, The only FDA-approved drug at the time was AZT. So in the movie, the way they show it is that the drug companies are pushing this through and really fast-tracking it. And they're doing trials in these big cities with it. But it's very toxic and it's very expensive. So yes, it kills, or helps to get the viral load down, but it also is very effective on the rest of the body, and your blood counts and everything else go down exponentially, and you get other problems from it. It's very hard to access. Ron gets into a clinical trial, but he realized that the side effects are like really devastating. You see at one point him like overdosing himself on it though. Like he goes, like he sees the trial going on and he goes like to like the delivery gate in the back and just like steals bottles and just like downing it. He's like, I'm going to kill this virus. I'm going to just like keep taking as many of these pills as I can. Ends up in the hospital. They're like, you can't take this anymore. And then he goes down to Mexico and he meets this other doctor who's doing his own sort of, not quite trials, but he has a clinic that he's experimenting with different medications, different vitamin regimens, using other things off-label. So interferon is something that we use for hepatitis, that he was using that, and other different compounds that he was trying to do. So what he does is, he's using like these protein treatments, supplements, and he sees sort of a business opportunity here. So through this, when he was in the hospital, he met Rayon, who's Jared Leto, transgender woman living with HIV. And at first, of course, he's like, get away from me. I'm not a fag. I'm not this. He's completely exactly as you would expect a 1980s cowboy to react. But Rayon shows him such kindness and compassion when he's going through like really being sick that she sort of grows on him. And you see the real human side. Like, yes, this is somebody who's cast out by society, not living the typical life that everyone expects, but is still human and like caring. It's really such an endearing character and has their own demons. Absolutely.
Grows on him in like a romantic sense or like a friendship sense?
No, it's just a really important friendship. Absolutely no romance whatsoever. You do see later in this once things are going, because he knows like I can't, give this to other people. But later in the movie, when he has people coming in to get these meds, and we'll get to that for a moment, but he's like, that one, she's got HIV, come in the back room. And he has sex with her because he's like, I need to have somebody else who has it.
Well, and I feel like that was a thing culturally for a while. It was like people were told that they could never have sex again. And they were like, well, we can with each other. Right. And so I think a lot of people found themselves that way. Also, I want to correct a misspoke. Matthew McConaughey won 12 awards for Dallas Buyers Club out of his total of 21 awards. The other things he won awards for were True Detective, Magic Mike, and some other like TV stuff. But
for like an Academy Award, that was
his only Academy Award. But for Dallas Buyers Club alone, he won 12 different awards.
Yeah, no, he's amazing in this. It really is amazing.
I mean, he's a good actor. He's very endearing. I also feel like he's kind of like a comedian and like a chill dude who seems high all the time. So you're like, he can't win awards, but it's like, no, he can.
I also think he probably smells.
I did see something once about he doesn't shower that often.
Yeah, I could see in person that he's probably a little stinky. But he's very good looking.
I was going to say, and his wife is gorgeous. So like, why would she be with him if he was that smelly? Her name is Camila Alves.
I don't know who that is. I have to look that up.
If you saw her, you'd be like, oh yeah, that lady.
That one.
Yeah. I think she used to be a model.
So essentially, at first he was making a deal with this Rayon, like, Rayon had made a deal with a friend of theirs. And this is kind of what gave him the idea. Rayon's like, I'm getting in the trial. I'm going to split my dose 50-50 with a friend of mine. And so that's what gave Ron the idea. Well, we can make money off this. So he starts pulling drugs from Mexico. In addition, he flies to Japan.
The drugs for the medication drugs, not like
drugs. Yes,
cocaine.
Yes.
Okay.
Medication drugs. He ends up making this club that charges $400 a month. Now, $400.
The Dallas Buyers Club.
Early 80s, though. But
That's
like
a lot of
in
money.
early 80s, $400 is a lot of money.
Yeah, but these are also people who are desperate,
right? And so if you're part of this club, you show up, he rents out this like seedy hotel room and makes it their base. And they line up outside and you come in, you got your $400 cash, you get your month's worth of medications. And essentially,
which in the grand scheme of things, people with insurance sometimes pay $400 for a month worth of meds. So
Right. Well, yeah, because unless they were in a trial, there's nothing else they could do. It was $10,000 for the other medication.
Yeah.
So it's sort of a legal loophole that sidesteps like a ban on selling unapproved drugs. And once he makes some cash, he flies to Japan, Israel, China, and gets drugs that are approved there or they're under trials there and brings them back. And he's not conducting clinical trials here, but he's just desperate trying to find anything because there's nothing else that these people have.
Well, and also for context, I don't think a lot of people were really in support of finding drugs to cure this.
Oh, no, because it was like, who cares? It's drug users and gay people. We don't care.
Right. Like let them die. So
right. Exactly.
I think that was maybe why he didn't have that oversight because people frankly didn't care.
Right. Repent for your sins kind of thing.
Which is all bullshit. We're not saying we believe that stuff.
No,
We're just saying what was going on.
Quotes. Yeah.
Yeah.
So they do have like this guy from like the trials and from the FDA always trying to like sidestep and like get him in trouble because they know he's doing this. I'm not sure if that part, how accurate it is or not. But he still kind of maintains a friendship with this doctor, that Dr. Evie Sachs, who's Jennifer Gardner, or Eve Sachs. And she starts seeing in her trials that the AZT, they're requiring blood transfusions. And she's saying like, this drug is toxic. Like this is the only thing we have. And it's helping, but hurting worse than it's helping. And so her hands are sort of tied. She's working for the hospital. She's an official doctor. But in the end, like he meets with her and she kind of empathizes with him. At one point, he does steal her prescription pad. I mean, not the greatest friendship choice there, but
he's not the first. He won't be the last.
Yeah. There's sort of a kinship, there in that she wants the right thing for him. In the end, though, Rayon, who became very, very close with him, does eventually pass. And Ron, when he loses Rayon, his like, really, it's his partner, but it's sort of what they call his moral mirror. It's a person who forced him to see humanity. Like I said, this goodness that you can see in other people. And in the type of people that he previously thought of as nothing, because he thought that anyone who was gay was garbage too, so it really, she taught him how to care for people. So instead of eventually, in the beginning, first, of course, he wants to give up, like he just wants to be done. But then he does keep fighting. He does go to court. He does advocate. He does get things fast-tracked in the right way. And they tell us at the end of the movie that he lived till 1992. So 7 years past that 30 days he was given. And his advocacy really helped shift the conversation around compassionate drug access. So that's approving or fast-tracking something because there's nothing else. And then also patient autonomy and FDA reform. So in the end, AZT was eventually approved at much lower doses and was, in the beginning, one of the first drugs we had. So that's kind of the story part. Let's go into the medical part of things. So we said HIV/AIDS, you might hear it referred both ways. First appeared in 1981 in medical reports, and it was weird infections and cancers that they only found in previously healthy gay men in California and New York. And so it was interesting and then they started to see that it also affected people who use injection drugs, who receive blood transfusions, and infants who are born to infected mothers. But they didn't know what it was. They just saw these things cropping up, but they didn't know why. So they actually didn't identify the virus till 1983. So, it was 2 years after the first case, which I guess is in that time pretty quick. Nowadays we'd have it like sequenced because we have DNA sequencing and we'd know the whole thing about like we did with COVID, but it was for that time very quick, for 2 years from discovery to actually identifying it. But it was still like we talked about, fear, stigma, discrimination. And then AZT was approved in 1987. And, like we said, originally toxic and then eventually lower dose was somewhat helpful.
Right.
But the turning point really didn't come till the mid-90s. So through the 80s, people suffered, people died. Like, it was a death sentence. It was worse than cancer. Cancer, there's a hope, right? This was, you're going to die. It's just how long. So in the 90s, they brought these highly active antiretroviral drugs, and they were combination therapy. So combining multiple drugs that targeted different parts of the virus. And so death rates dropped dramatically, and it went from a death sentence to like something manageable. So now you don't die from AIDS, you live with AIDS, or you live with HIV. You don't even get to AIDS. You'll die from heart disease or cancer or something unrelated. If you are on appropriate therapy, you will not die from HIV. You will live with HIV, just like you live with COPD or diabetes or hypertension.
And wasn't that part of the thing in the beginning? Because a lot before they could really identify it, a lot of people were dying from like pneumonia or like infections.
And so that's exactly what it is. Right. So we'll get into how that happens. But, we talk about this in where we live in the United States, but sub-Saharan Africa still sees millions of deaths annually from this. Mm-hmm. So yes, in our little bubble, it's no big deal, but it still is worldwide an issue.
Right. And it's the same with many other disorders too. Like,
absolutely.
We have, despite how difficult our system is, we still at the core have better access than many other countries, and most people can get their medications compared to other countries.
So currently worldwide, there are 40 million people living with HIV. Each year, there are 1.65 million new infections. There are about 718,000 deaths. So, compared to how many people are living with it, it's luckily not as high as you'd think. About 86% of people globally know their status, and about 76% are on treatment. 68% globally are virally suppressed. So, we know the basics.
Essentially like in remission.
Yeah. Yeah. Most people who found appropriate therapy and are actually following up their viral loads are undetectable. Like, I have 2 patients I can think of that I know, and their viral loads are undetectable.
Well, isn't that the case for both? Was it Magic Johnson? Was he the basketball player?
Yeah, basketball player.
And Charlie Sheen.
Yes. Because with appropriate treatment, that's where we are. Now, Magic Johnson was a little earlier and was questionable.
Well, and I think we also suspect that he maybe had the means to have earlier access to some of the stuff that later.
Yeah, because it was before that was even a thing.
Yeah.
But basically, let's go back to basics. How is HIV spread? It's transmitted through body fluids, specifically blood, semen, vaginal fluid, rectal fluid, and breast milk. So not saliva, not, I touch their skin.
Not by breathing on someone or coughing or laughing or hugging.
Exactly. So what's crazy is I had a patient who was going for dental implants, and the clearance required HIV, hepatitis testing, syphilis. I'm like, what do you think is happening here? They're not biting you. You're putting them under.
But that's what I'm saying. They're putting you under, and teeth are sharp.
Yeah, but no, I've done a million clearances for a million different things. I have never, ever. People who are doing open, wide surgeries with their arms inside your gut are not asking for your HIV test.
I agree with you, but I also extra. I agree with you. It's excessive, but I can also see where someone might still want to have that done.
I think it's just beyond recommendations by any society. I was just like shocked. I was like, okay, sure.
Well, and I also feel like even though people are living longer and living healthier lives with it, and there's things like PrEP, which I'm sure you'll get into, I feel like there are still some people who have that underlying stigma about it.
Yeah. But if you're in medical, even dental adjacent, you should know this.
I don't know if you remember, but I distinctly remember, and maybe it's, a Mandela effect in my head, but wasn't there at some point, like in the peak of the AIDS epidemic, there were nuns who would just go to the hospitals and hug AIDS patients who were like in treatment because nobody would hug them.
Sounds
I remember
good.
there was something about like people who you would think would not go were like just going and just like hugging and sitting with people. And it was just like, just like be a human, be empathetic.
Yeah. I mean, I have no qualms examining my patients with no gloves on when I'm just listening to their heart and lungs. You know, it's not, there's just a person.
Yeah.
So specifically like the rate of transmission. So the highest rate of transmission would be receptive anal sex. So that is why the gay population was the first population that we saw, because just by the nature of what receptive anal sex is, there are more likely to be fissures or things where a body fluid then could have access into the other person's body. So
yeah, I was going to say, I think another part of that original group too were sex workers.
Yeah, of course. Absolutely.
Who also may be engaging in more of that as well. So
so that's the highest risk. Needle sharing is still a pretty high risk. So like 63 per 10,000. And then receptive vaginal sex is only about 8 per 10,000, which is interesting because biologically, I want to word this in a way that is very respectful, because this is just a medical thing, that the vagina was meant to accept a penis, and so it doesn't tear as easily as an anus does. Like, that's just biology, and so there's less likely to be a tear.
I'm just laughing. I'm like, I think a lot of lesbians would disagree with you that their vagina is meant to accept a penis.
I know. I'm just talking like pure on
biologically,
continuing the species the way
it's
evolution
built to take
happened.
Some damage is what I'm hearing.
Right. So there's not going to be tears, and so then you're less likely. So that's only 8 per 10,000.
Yeah.
So if your viral load is undetectable, you cannot sexually transmit it. So if you are on perfect treatment, you cannot. You take your pills every day and you go to your doctor every 3 months and you have your viral loads checked, you cannot give it. So think about that. It's untransmittable. That's where we are today. But let's talk a little bit about how it works, why it's so bad, why it's so scary. So essentially, it's a retrovirus, and it primarily attacks your CD4 cells. They're very important white blood cells that coordinate with your immune system response. They're sort of like the generals of the army. They sort of like, you go here, treat this, you go fix that. And so HIV binds to those cells on the surface, injects its genetic material, hijacks that cell's machinery, and makes it into a factory. So that's how viruses work in general. They hijack your own cells to reproduce. But this specifically attacks CD4 cells. So, basically it kills those cells. So your CD4 counts go down, and it's chronic immune activation. So your immune system is in a constant state of alarm, basically burning out and becoming dysfunctional. So there's kind of two ways the way that works. So CD4 counts are the other thing. So we said viral load. That's the one big thing we always check. But your CD4 count is essential to know, because that tells us what you're at risk of infection-wise. And sort of the line is 200. So a CD4 count below 200 is AIDS. Above 200 is not.
Mm-hmm.
But there's of course a gradient, right? That's one line in the sand, but there's a gradient. So
what's the difference between HIV and nothing? Like that number? Or are you using that term interchangeably right now?
What do you mean?
HIV and AIDS.
So AIDS is when you have, this is what I'm getting to. So HIV is you have this virus. AIDS is.
So what you're saying is that's when it's progressed to AIDS, is when you have this. Okay.
You have less than 200 cells, and you have an opportunistic infection or an opportunistic specific types of cancer that are associated with it.
So essentially like the progression.
Right. So normal CD4 count, 500 to 1500, you're fine. 350 to 500, they want to work on, monitoring your treatment. 200 to 350, infection risk. So some things they might start prophylaxis. So they might start certain antibiotics to prevent you from getting infections. And then less than 200 is considered AIDS. high opportunistic infection risk, mandatory prophylaxis. So then you have to be on a medication to prevent. And ART, which is certain kinds of treatment, is urgently needed. And then you go down from there, and basically less than 50 cells, your morbidity, mortality are very high. So the big thing, they love to change the names of diseases. I love this. So when I went to school, it was called PCP. It was pneumocystis carini.
It was like drug PCP?
No, PCP was pneumocystis carini. It is the sort of defining opportunistic type of pneumonia that is basically pathognomonic for HIV / now you have the AIDS. They changed the name to pneumocystis jurovici or Juve. I don't know.
They changed is it Italian now?
It's now PJP. Like, why do you need to change the name? But anyway.
Because people thought PCP was the drug.
So that is essentially the line. So that CD4 count below 200, you start them on prophylaxis to prevent that particular lung infection, which is Bactrim, is the brand name. Trimethoprim sulfa, blah, 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 is the generic name. Then if they drop down to 150, you stay on the same because that Bactrim actually still covers for the next bacteria that's also big is Toxoplasmosis gondii. If they go even further down.
Is that the one you get from cat poop?
No, there is a Toxoplasma that is from cats. Yes, in pregnancy. That's the one. You don't touch cat poop while you're pregnant.
That's the one I'm talking about.
Okay. And if you go down further below 50, then you have to add additional medication, azithromycin. We've all heard of a Z-Pak, but it's not a Z-Pak that goes down. It's actually 1,200 milligrams weekly to prevent something called Mycobacterium avium complex. So another lung type infection. You do need to look out for risk of TB exposure. And then you also need to make sure that they are immune to varicella, which is chickenpox. You can't give that vaccine, though, if they're severely immunocompromised because it's a live vaccine. Now,
and we talked about that in an episode last year, the difference between live vaccines and...
Yeah. So what's interesting is our generation, we had chickenpox. Mid-90s.
Wait, people don't get chickenpox anymore?
No, they started vaccinating for it in the 90s. So there are people who are born, like, there's sort of this border where some people were born and maybe if their pediatrician, it was brand new, didn't push it, maybe never got the vaccine, and they might be adults who are not vaccinated. But most people from a certain point on are vaccinated. So both my children are vaccinated. They'll never get chickenpox. But it is a live vaccine, so it cannot be given in an immunocompromised person. So you can't give it to someone on chemotherapy or like is it with HIV. So if you're kind of SOL, if you get to this point and you weren't vaccinated as a child, they might put you on an antiviral treatment to prevent you from getting chickenpox at that point as prophylaxis.
I hope this expression I'm making is my thumbnail, but you just blew my mind. I thought kids still got chickenpox. I had no idea.
Yeah, the vaccine's been out since the 90s.
I mean, I knew, but like I still thought like you still get it and it's a thing and you just deal with it.
Right. No chickenpox. What's interesting
my mind is blown. I had no idea.
Another vaccine that we were that crux point for is Hep B.
I knew that.
So Hep B came out in the early 90s. So I think varicella was the late 90s. So we would have been in high school, but Hep B came out when we were like 11, 12-ish. And so it kind of depended because now we give Hep B to infants. So depending if your pediatrician did like sort of a catch-up
we're giving the vaccine to infants, not actual Hep B. We're giving babies Hep B.
But so there's many people of our generation are not vaccinated against Hep B. I was. And it was funny is I remember, it's so weird that I remember my pediatrician saying, this vaccine now, it's for this hepatitis. I really recommend it. And my mom being like, sure, go ahead. Whatever you recommend, I trust you. And getting it. But there's so many people now that when they go for jobs in healthcare, because that's one of the things that's very important because of bloodborne exposures. So people who are going to jobs in healthcare get tested for antibodies, realize they're not vaccinated, then we need to vaccinate them as adults. But anyway, that's an offshoot, but a little history right there. So baseline workup is, there's a screening test and then confirmatory tests. Once you have a confirmatory test, then you want to check a viral load, a CD4 count, and there's like a genotype and resistance testing. So there are like slight differences. I am not somebody who's well versed in the differences in the genotype of which HIV, but it's not, the treatment is essentially the same, but for an infectious disease, that might be important. You're going to check a blood cell count. You're going to check their kidney and liver function, some basic labs for their cholesterol, their hepatitis, like we said, whether they're immune, syphilis. They check them for gonorrhea, chlamydia, screen them for tuberculosis because they're going to be at higher risk. And then they are going to check for those things we talked about, toxoplasma, CMV, do a pap smear, pregnancy test. So, just trying to kind of get a good hold on where we are and what our risk factors are. And then treatment. This is the thing, ongoing monitoring and treatment. So you get on your treatment, you follow your ID doctor, or nowadays a lot of primaries are even doing it. I don't feel like I'm well versed in it. I could probably do a course and feel more comfortable, but it doesn't quite fit my population at the moment. That could change. But essentially, if you're getting your labs every 3 months and you're following and you're taking your meds faithfully, you will live and not die from this. So modern antiretroviral therapy, it blocks at different areas. So these are all combo drugs now, which are pretty neat. So it used to be you'd have to take literally like this many I'm making a big handful sign for our listeners. Handful of pills, like literally like
it used to be like
pills.
A big cocktail of lots of stuff.
Exactly. But now they throw them all in combos. So they'll be like a triple therapy drug. So you may have heard like commercials for Biktarvy. That's the most common. That's a triple. Triumic is another triple, and Dovato is another triple. Those are kind of the most common ones because they're hitting 3 different types from different directions, different types of drugs, just like we would have 3 different blood pressure meds or 3 different whatever, same concept.
And so those are PrEP drugs that I've said like PrEP like 5 times, but I don't even know what it stands for.
So PrEP and PEP are 2 different things that we can get to. These are treatments, but some of these same drugs are used for PrEP and PEP.
Okay.
And there's some long-acting drugs. I guess if sometimes these patients have comorbidities of mental health, drug abuse, they might not be as compliant with follow-up. There are some injectable drugs that can be done for maintenance that are a little more accessible, maybe for somebody who might not be great with their following up. But yeah, PrEP is pre-exposure prophylaxis. So that's
I knew it was pre-something.
Yeah, so that's an HIV negative person that takes medication daily to prevent infection. It's more than 90% effective with consistent use. So there are a couple different options out there, but essentially, if you asked and you came into my office, I'd look up on my most, recent app what the best, easiest to take, most tolerated, and hopefully covered by insurance PrEP is, and I would absolutely give it to you, no problem. PEP is post-exposure prophylaxis. So just like in our SANE nurse episode, we talked about that. So you were exposed. You had unprotected sex and you're concerned. You had a needle stick. You used IV drugs that, with a shared needle. You can take a post-exposure dose, which is a 28-day course of those medications. You need to start it within 72 hours, ideally 24, but 72 will still work, and continue it for that 28 days. And that really reduces significantly your risk. So we're just in like an amazing place right now where I feel it's no longer the big scary thing that we grew up with. Like that evolution in our lifetime is medicine at its work right there.
And I feel like that evolution, I feel like nobody ever really talks about it. It was just like AIDS, HIV is a big thing. Not a big deal anymore.
Because if we cured, all cancer,
which would never happen for financial reasons.
Right. Well, also because there's many different types of cancer.
True.
Because you know someone with cancer. You probably know someone with HIV.
Yeah,
but
and
you
don't even know it.
Know that you know somebody with HIV.
Exactly.
Because there's a stigma. Because it's, associated with, gay people, drug use, promiscuity, whatever.
Well, I also think the other side of it is the people, when all of this was happening, the people we did know who had it, they did end up passing eventually. Just maybe they got a little bit of an extended lifeline, but most of them did end up passing regardless. And so they didn't necessarily get to the point where we are now with the medications and the long life expectancy.
Yeah. So it's not something they're celebrating because it's not people that the general public cares about in the same way that they do, grandma with colon cancer.
Which, unfortunately, it's an uncomfortable reality that we have to admit to, that is part of...
Yeah. It's the stigma still exists. I mean, it's better, but it still exists.
Yeah.
You really have to credit the LGBTQIA+ community.
Yes.
I got all the letters right.
You got it.
For doing the work.
Yes.
Right?
And not being quiet about it. Continuing to push forward despite all of the brick walls and being turned away. Yeah.
I think they've made things like this more acceptable. Go out, get your PrEP.
Yeah.
Go, take care of yourself. Be safe. And knowing your status and going for your college clinic and getting your rapid HIV test. I just think couples even now, are coming out and saying, okay, we're a new relationship. We're going to get tested before we do anything. And having an honest conversation like that, I think that's amazing.
Yeah. Yeah.
I think we're just in such a different place than we were in the early 80s. So I think in our lifetime, this is probably one of the biggest. There's been a lot of
the biggest medical breakthroughs, definitely.
Yeah, I mean, there's been medical, but this was a definite death sentence to none at all. Other things have improved, but this is the one.
I think the closest thing that comes to it, but still doesn't reach the whole scope, is having the COVID vaccine and reducing the incidence of death from COVID. Right. But even that was a little bit more calculated, and I don't feel like there was as much of a fight that people who had it had to fight for themselves for their treatment.
Right. I mean, I think, yes, we've made, amazing strides in heart disease, amazing strides in diabetes. Those are the two things that I can see. But not every single person who got diabetes was a death sentence. Not every single person who had a little clogging in their arteries was a death sentence. This was, you will die. It's just when. Yeah. So I think we don't give it enough credit. And there is World AIDS Day. I don't know when that is. I should look that up.
It is my birthday, December 1st.
Oh, look at you.
Yes.
You knew that. All right. So World AIDS Day. So we're in Pride
Kind
Month
of a damper
now.
for my birthday, but yes, it is.
Well, but we got to think about it in that positive aspect of where we were and where we are now. So I just think that, I think this is a lot of technical in this episode, but at the same time, it's super cool where we've come, science and society, getting this fixed, getting this done, taking care of people for where they had to fight for it. But yeah, it was pretty cool. And to know that was a true story, the whole Dallas Buyers Club was pretty neat.
Yeah. Very cool. So I think for people, because I mentioned it before, who don't know the story of Philadelphia, my understanding of that is it was more of a fight about, was it with the workplace? And then wasn't it also something about partners being able to access benefits after someone passes?
Yes, let me tell you.
I did see Philadelphia, but it was so long ago that I can't tell you all the details.
Okay, Philadelphia. We know who stars in that, correct?
Tom Hanks.
Yes.
Forrest Gump.
Denzel Washington.
Oh, yes,
two
I always
of our
forget.
faves.
Denzel.
It tells
Denzel
the story
over
of
Tom every day.
The attorney, Tom Hanks, who comes to ask a personal injury attorney, Denzel Washington, to help him sue his former law firm, who fired him after discovering he was gay and he had AIDS. So it is the first mainstream Hollywood film to address AIDS. So it is prior to Dallas Buyers Club. Is it based on a real thing?
I believe it is. I believe it's based on a true story.
Doesn't say. No, it says it's a legal drama. It does not say based on a real story. I'm not going to read the whole Wikipedia page on it, but essentially it is another touch point in the history of this and just understanding it. It also has Antonio Banderas.
Yeah, he was Tom Hanks's lover.
Oh.
Antonio Banderas.
He is a handsome man.
Who is also technically Melanie Griffin's lover in real life.
In real life. Oh, and that song, you know, The Streets of Philadelphia by Bruce Springsteen. New Jersey, Bruce Springsteen.
Philadelphia.
He's always here. And Tom Hanks won Best Actor.
I mean, Tom Hanks has won Best Actor for a lot of things.
I know. We love him.
My favorite Tom is Forrest Gump Tom.
I do love a Forrest Gump Tom. I do. He's amazing. I mean, I can't tell you. I love Tom in Big. Come on. Let's go back.
Yeah.
There's nothing he could do wrong.
If I have to pick one Tom, it's Forrest.
Yeah.
Life is like a box of chocolates. I saw a TikTok recently. This is a tangent. I saw a TikTok recently, and it was like about Forrest Gump. And it says, it's so funny. The main villain in Forrest Gump is Jenny.
Oh. Doesn't Jenny die from AIDS? Wait, doesn't Jenny die from AIDS?
She does. Mm-hmm.
Yeah, but we just came full circle right there with our references.
We did. But yes, Jenny is the villain in Forrest Gump, which I think it tracks. I mean, we know where it comes from. She has her trauma, but Jenny is the villain.
So much history seen in his lifetime in that movie. It's not kid appropriate yet, I don't think. I can't show that to my children yet, right?
I think
oldest one could handle it.
I think Lieutenant Dan losing his legs is not great for kiddos right now.
Yeah.
I had heard rumblings that they were going to do like a sequel of like Little Forrest and like follow like his adventures in his life.
Okay.
No, Little Forrest, like his son.
Oh, his son.
Yeah. That's Little Forrest. Because if you think about it, like it would be cool to see Little Forrest and all the things that happened during his generation.
Right. Different.
But also Little Forrest is super smart. Pretty sure Little Forrest has autism based on a rewatch of that movie. But Regular Forrest did not. Regular Forrest had intellectual disability. We can confirm that.
Yes. All right. So we have the tangents of tangents. Look at tangents.
I can keep going. I can keep
movies,
going.
Like amazing movies. Go out there and watch those Academy
Award
winners.
Don't get me started on Robin Wright Penn. I can get you all the way to the Princess Bride.
My kids do like The Princess Bride, though. That is a classic. They will ask to watch it.
You challenge me to a tangent. I see your challenge, and I raise you. That Robin Wright Penn was married to Sean Penn, who was married to Madonna.
Oh, are we doing like 6 degrees of separation right now?
Yes. Did Madonna date?
She dated the basketball player. What's his name?
No, I'm going to say, did she date Kevin Bacon? Because if I did, then I got my Kevin Bacon.
No, 6 degrees of Kevin Bacon. No, but I'm sure we could get it back to Kevin Bacon. We could if we really tried.
I'm sure.
It was in the movie Tremors.
I'm sure that they were in a movie together.
Or Footloose. I mean, you got to go from there.
I'm dancing to Footloose in my head now. Sorry. We did it. We did a tangent.
We did. All right. I think this is a good one. So yeah, everyone get out there, get your pep and prep. Thank you for listening to Medical Media Mixer.
The perfect cocktail. Cheers.
This drink was good. I finished it.
Yay.
There's just ice left.
Nice.
Ooh, where'd you go? Stop.
I'm right here.
Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon. Patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.